Good afternoon, bon l'après-midi à tous. Today I'll say a few words on the importance of individual efforts for maintaining epidemic control. But first, an update on the latest numbers of COVID-19 in Canada. There have been 104,772 cases, including 8,642 deaths. 65% of people have now recovered. Labs across Canada have tested over 2,848,000 people for COVID-19 to date. Over the past week, an average of 37,000 people were tested daily, with a 1% testing positive. These numbers change quickly and are updated daily in the evenings on canada.ca/coronavirus. Now that summer is fully underway in Canada, and while we are learning to live with COVID-19, I want to remind Canadians of actions we can all take to reduce our own risk and help control the spread of the novel virus. Individual behaviors can either help or hinder the spread of the virus. We all need to consider our own level of risk and make informed decisions. Certain groups that are higher risk, such as seniors and those with underlying medical conditions, should take extra precautions to protect themselves. We need to be aware of the risk of COVID-19 exposure in our area and the current advice and recommendations of local public health. This also means practicing the behaviors we know will stop the spread of the virus, including physical distancing, meticulous hand hygiene, staying home and away from others if you're sick, and wearing a non-medical mask or face covering when it's difficult to keep 2 meters distance from others. Beyond these individual behaviors, we can also reduce our risk by limiting the times we spend in higher risk environments and activities. We know from the evidence in Canada and internationally that larger gatherings and indoor settings pose a higher risk for infection. This is why I am advising Canadians to try and avoid the 3 C's: closed spaces with poor ventilation, crowded places with larger numbers of people gathered, and close contacts where you can't keep the optimal physical distance from others. This pandemic is teaching us a lot about being flexible and adapting to new challenges. I'm so proud of Canada's efforts to date and all the creative ways people are finding to stay together while keeping apart. From this week's virtual fireworks displays to the revival of drive-in movies and concerts. While we reopen social and economic spaces, I encourage everyone to keep up the hard work of following public health advice to lower the risk for yourself and the people in your contact bubbles, especially those at higher risk of severe illness. Keeping COVID-19 under control and away from vulnerable populations is a shared responsibility.
Bonjour. Aujourd'hui, je vous parlerai un peu de l'importance des efforts individuels pour conserver la maîtrise de l'épidémie. Et tout d'abord, je commencerai par vous présenter les derniers chiffres sur la COVID-19 au Canada. Il y a eu 104 772 cas confirmés, dont 8 642 décès et 65% des personnes infectées sont maintenant rétablies. À ce jour, les laboratoires de partout au Canada ont analysé les tests de dépistage de la COVID-19 de plus de 2 848 000 personnes. Au cours de la dernière semaine, nous avons testé en moyenne 37 000 personnes chaque jour, dont 1% ont reçu un résultat positif. Ces chiffres changent rapidement et sont mis à jour quotidiennement en soirée sur le site canada.ca/le coronavirus. Maintenant que l'été bat son plein au Canada, tandis que nous apprenons à vivre avec la COVID-19, on vous rappelle aux Canadiens les mesures que nous pouvons tous prendre pour réduire notre propre risque d'exposition et aider à limiter la propagation de nouveaux coronavirus. Les comportements individuels peuvent soit favoriser la propagation du virus, soit y faire obstacle. Nous devons tous tenir compte de notre propre niveau de risque et prendre des décisions éclairées. Certains groupes de personnes qui présentent un risque élevé, comme les aînés et les personnes qui ont des problèmes de santé sous-jacents, devraient prendre des précautions supplémentaires pour se protéger. Nous devons être au courant du risque d'exposition à la COVID-19 dans notre région, ainsi que des recommandations et des conseils actuels de l'autorité locale de santé publique. Cela signifie également de mettre en pratique les comportements qui, nous le savons, permettront d'arrêter la propagation du virus. Pratiquer l'éloignement physique, appliquer rigoureusement les pratiques d'hygiène des mains, rester à la maison, loin des autres quand nous sommes malades et porter un masque non médical ou un couvre-visage lorsqu'il est difficile de garder une distance de 2 mètres des autres personnes. Au-delà de ces comportements individuels, nous pouvons également réduire notre risque en limitant le temps que nous passons dans des environnements à risque élevé et que nous consacrons à des activités à risque élevé. Selon les données recueillies au Canada et ailleurs dans le monde, nous savons que les grands rassemblements et les activités intérieures posent un risque élevé d'infection. C'est pourquoi on demande aux Canadiens d'éviter les 3 situations suivantes. Les endroits clos, mal aérés, les endroits bondés où sont rassemblées de nombreuses personnes et troisièmement, des contacts étroits qui ne permettent pas de maintenir une distance physique optimale par rapport aux autres personnes. Dans le contexte de la pandémie actuelle, nous en apprenons beaucoup sur la capacité de faire preuve de souplesse et de s'adapter aux nouveaux défis. On est très fiers des efforts déployés par le Canada jusqu'à présent et des façons créatives qui trouvent les gens pour rester en contact, bien qu'ils soient séparés. Qu'il s'agisse des feux artifices virtuels de cette semaine ou de regains d'intérêt pour la formule Cinépark à la fois pour les films et les concerts. Tandis que nous rouvrons les espaces sociaux et économiques, on vous encourage tous à poursuivre vos efforts et à suivre les conseils de santé publique, dans le but de réduire les risques pour vous-même et pour les personnes avec qui vous avez des contacts, en particulier celles qui présentent un risque élevé de maladies graves. Il incombe à l'Assemblée des Canadiens de contribuer à maîtriser la COVID-19 et à faire en sorte que les populations vulnérables n'y soient pas exposées. Merci.
Okay, thank you, doctors. We will now open the floor to questions. Vous pouvez poser vos questions dans l'une des 2 langues officielles. We ask that you limit yourself to 1 question and only 1 follow-up. Operator, over to you.
Thank you. Merci. Please press star 1 if you would like to ask a question. Veuillez appuyer sur étoile 1 si vous désirez poser une question. Our first question, notre première question, nous vient de Theresa Wright with the Canadian Press. Please go ahead. À vous la parole.
Yes, thank you. My question is for Dr. Tam. The Blue Jays have permission to hold a training camp in Toronto, but they want to host games there with teams coming in and out. Is using the Rogers Centre and its hotel as a quarantine facility for U.S.-based teams playing in Toronto a solution that you'd consider acceptable?
So the key is the coordination on the ground with the local public health department as well, because they will have much more insight into the actual facilities, etc. But yes, absolutely. The idea is that any players coming in a, let's say, a cohort or a bubble quarantine situation has strict protocols to mitigate risk and not to interact or spread illness, of course, to the surrounding community. And I think that is why there's specific arrangements for their living area as well as, of course, the site of the games. So that is, those detailed plans have been reviewed by different levels of government.
It's Dr. Njoo. Maybe I can add to that. Certainly the plans that Dr. Tam and myself and others have reviewed have related specifically to the spring training aspect for the Blue Jays. They're based on the plans in terms of what Dr. Tam described as a tight bubble, and certainly the support of local authorities. It seems reasonable for the Blue Jays to come up here and quote their work bubble and do their spring training. However, if you're talking about the regular season, that's a totally different ballgame, if I can use that pun. Certainly, lots to still be considered. It's not clear, at least to me, in terms of what the expectations might be for the visiting teams. You know, the players, are they allowed to live at home? What is sort of the interaction that they would have in terms of them and their families and the communities, etc., and of course the whole issue in terms of going back and forth across the border. So I think at this point we're just focused on, quote, the spring training for the Blue Jays, and we'll take it as it goes in terms of getting more detailed plans in terms of what they may actually anticipate for the regular season. Thank you.
Thank you, doctors. And your follow-up?
Yes, thank you. I'm wondering if either of you are aware of any cases or outbreaks of COVID-19 tied to the Black Lives Matter protests.
We are not aware of this. The local or provincial health department have not provided any kind of signal that has occurred. That doesn't mean that something couldn't have occurred, but we have not heard any actual reports of that happening in Canada.
Thank you, Dr. Tam. Operator, next question on the line.
Thank you. Merci. Our next question. Notre prochaine question nous vient de Catherine Lévesque avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous deux. Je voulais vous entendre sur les États-Unis. On sait que il y a vraiment là une situation catastrophique là-bas, qu'il y a de nombreux cas à tous les jours. Je me demandais dans cette perspective-là, considérant que plusieurs États américains sont obligés de se reconfiner, de remettre des mesures vu l'explosion des cas, est-ce que le Canada peut vraiment se permettre d'ouvrir sa frontière le 21 juillet prochain?
Merci pour la question, c'est Dr. Njoo. C'est sûr que nous autres, de la perspective de santé publique, on suit très étroitement qu'est-ce qui se passe actuellement aux États-Unis et c'est sûr que c'est inquiétant pour tous les experts, les autorités de santé publique des deux côtés de la frontière. Pour nous autres ici au Canada, je pense que c'est aussi, comment dire, une bonne leçon parce que avec qu'est-ce qui se passe aux États-Unis, ça souligne le point ici au Canada. Quand ici on commence avec l'assouplissement des mesures de santé publique, c'est vraiment ici dans chaque province et territoire, toutes les autorités de santé publique savent très bien que il faut faire ça avec beaucoup de prudence parce que si on avance trop vite, c'est sûr on peut tomber dans la même situation qu'avec qu'est-ce qui se passe dans plusieurs États aux États-Unis. Concernant la frontière, oui, c'est inquiétant. Nous autres, on est toujours en bonne discussion avec nos homologues des provinces et territoires pour échanger notre perspective de santé publique. Ce que je peux vous dire aussi que, en principe, si on parle strictement de la perspective de santé publique, on sait que les frontières entre pays ou même dans les régions, c'est une frontière artificielle. Et si on veut peut-être permettre, l'échange aussi pour les personnes pour traverser la frontière, on utilise des fois deux principes. Si l'épidémiologie est plus ou moins pareil des deux côtés d'une frontière, et aussi la capacité pour détecter, pour traiter isolement le suivi, le traçage de contact est pas mal pareil de deux côtés d'une frontière. On peut peut-être considérer c'est peut-être un peu assouplir les mesures pour les frontières. C'est ça ce qui se passe, ce que je vois actuellement en Europe. Et je pense que nous autres, on continue à examiner l'évidence, la science aussi, les données probantes avant de donner nos meilleures recommandations de santé, de la perspective de santé publique aux décideurs. Merci.
Puis votre suivi?
Oui, absolument. Et donc, est-ce que je dois en comprendre que vous êtes d'accord finalement à l'idée d'assouplir les frontières avec l'Union européenne? Et sur un tout autre sujet, si je peux me permettre, on a vu dans les plus récents cas à Montréal de COVID-19, en fait, que ce sont les 20 à 29 ans qui sont les principaux transmetteurs pour la transmission communautaire de la COVID. Je me demandais si c'était un phénomène qu'on voyait à travers le Canada. Est-ce qu'on est en train de constater actuellement que ce sont les jeunes qui sont à la base là, des quelques cas qu'on voit actuellement? Merci.
OK, merci encore pour la question. Pour la première question, oui, on est toujours en bon contact avec nos homologues de santé publique en Europe, aux États-Unis, partout. Et c'est sûr, on est en train d'analyser c'est quoi peut-être, comment dire, les indicateurs, c'est quoi peut-être les mesures on peut utiliser avec la science et les données probantes qui nous permettent de peut-être prendre les décisions concernant peut-être les voyageurs ou les touristes. Et on a vu que en Europe, ils ont mis en vigueur des fois une plan pour laisser rentrer les citoyens, les résidents de quelques pays qu'ils considèrent comme le pays sont dans une situation assez bien contrôlée par la COVID-19, c'est plus ou moins pareil avec l'Europe. Et ce que je comprends, le Canada actuellement est sur cette liste. Donc, nous autres ici au Canada, on continue aussi à analyser les données des pays à travers le monde et il y a toutes sortes d'indicateurs et nous sommes, c'est un enjeu actuel, on continue à discuter avec nos homologues, aussi avec des provinces et territoires. Concernant qu'est-ce qui se passe à Montréal avec les jeunes, on a des rapports, c'est encore un peu comme des anecdotes, mais il y a aussi quelques données qui nous indiquent que oui, peut-être que les jeunes, c'est sûr que les jeunes ont moins de risques pour avoir les conséquences graves, les maladies graves s'ils sont contaminés, infectés avec le virus. Mais ce qui est peut-être un peu inquiétant, c'est que peut-être les jeunes, peut-être en général, c'est difficile pour toujours généraliser, peut-être prennent moins sérieux la situation et qu'est-ce qui se passe avec le virus. Donc, Dr. Tam, moi et toutes les autorités de santé publique de toutes les provinces et territoires, nous autres, on souligne toujours le point que tout le monde est susceptible au virus. Et même si c'est les aînés, les personnes avec des conditions médicales sous-jacentes qui sont plus à risque d'avoir les conséquences plus graves, il y a encore des cas des jeunes qui vraiment ont subi une maladie grave. Et c'est pas seulement une question pour les jeunes, c'est aussi que l'autre aspect important, c'est que les jeunes peuvent transmettre le virus aux autres personnes, peut-être leurs grands-parents, même leurs parents qui sont plus âgés, et aussi peut-être les amis et les autres personnes avec des conditions médicales sous-jacentes. Donc, je sais que c'est peut-être un défi, mais c'est très important de souligner que c'est pour tout le monde. Il faut toujours pratiquer les bonnes pratiques de santé publique déjà bien éprouvées, garder la distanciation physique de 2 mètres, de bonnes hygiènes pour se laver les mains, etc.
Merci, Dr. Njoo. Next question on the line.
Thank you. Merci. Our next question. Notre prochaine question nous vient de Michel Lamarche avec TVA. Please go ahead. À vous la parole.
Bonjour. J'aimerais vous entendre. Prévalu la possibilité d'aller à Washington la semaine prochaine pour un sommet avec les États-Unis et le Mexique. Est-ce que le premier ministre va devoir se soumettre à la quarantaine obligatoire de 14 jours en revenant au pays?
Peut-être moi je commence à répondre et peut-être Dr. Tam a aussi quelque chose à ajouter. Je pense que tous les Canadiens et Canadiennes comprenons aussi notre premier ministre que c'est très clair avec notre loi sur la mise en quarantaine. Si un Canadien quitte ou sort du pays, en revenant, tous les Canadiens et Canadiennes sont, ils sont obligés, selon notre loi sur la mise en quarantaine, d'être sur une quarantaine obligatoire pour 14 jours après leur rentrée au pays. Il y a toujours une possibilité de voir une exception. Par exemple, on a déjà parlé des sports professionnels comme les Blue Jays. Si on nous donne un plan pour montrer c'est quoi les mesures supplémentaires, c'est quoi les précautions, qu'est-ce que peut-être le premier ministre ou n'importe qui va faire pour vraiment montrer que le risque d'exposition est très minime. On peut considérer peut-être donner une exemption, mais en principe, tous les Canadiens qui sortent du pays sont obligés de suivre la loi sur la mise en quarantaine. The question was about the Prime Minister, if he was to leave the country, what would happen if he came back? And I would just say that in general, according to our Quarantine Act, all Canadians are certainly free to leave the country, but if they do come back, they're certainly subject to our Quarantine Act, and the fact right now we have a sort of obligatory quarantine for 14 days upon re-entry. However, as we just talked about for professional sports, if any group of individuals or a person does maybe submit a very specific plan that would show that they were taking exceptional, extraordinary measures to minimize the risk and maybe ask for quote an exemption, and then certainly they are free to submit the plan. And I will leave to Dr. Tam to certainly consider any plan for an exemption to be looked at on a case-by-case basis. Dr. Tam?
Just to clarify, though, on the sports teams, they are in quarantine. They're just in a group quarantine, but they are actually in a modified quarantine. So that exemption is not provided so that people can just roam around Canada. This is a very, very specific plan. And in the case of the Blue Jays, as Dr. Njoo said, for phase 1 and 2 of the training. So, the answer to the question is that all Canadians who leave and then come back are currently subject to a mandated 14-day quarantine.
Merci. Puis votre suivi, Michel?
Wait, so listening to you, Dr. Tam, it would maybe look strange to every Canadian if the Prime Minister was coming back from Washington and didn't have to quarantine at all.
As I said, anyone coming in and Canadians coming back are subjected to a mandatory 14-day quarantine.
Thank you, Dr. Tam. So we'll now turn to the room for the next question. Mackenzie?
Hi, doctors. Mackenzie Gray from CTV. Following up on the question about Washington, there have been a number of staffers around President Trump and other people and associates who work with him who've recently tested positive for COVID-19. The advice from you and the advice that the Prime Minister has been following is to work from home as much as possible and do everything you can to avoid these face-to-face meetings. I think it is a good idea for the Prime Minister to potentially expose himself to people who have potentially recently tested positive for the virus?
I don't know the specific circumstances, no. I mean, it's not a question that I've been posed, but, my advice is the same for all Canadians in terms of reducing their risk as much as possible through all those things I've just mentioned in my opening remarks. So, absolutely. Every situation and every individual has to take into account that very specific set of personal risk assessments and minimize that risk as much as possible. And so that's not my decision to make, but this is the general public health advice.
Just to clarify, Dr. Chairman, you said no, you meant no that the Prime Minister's office has not spoken to you about him going?
Correct.
Okay, so my second question is related to something Dr. Fauci said in the U.S. He said that it's unlikely that in the U.S. they'll be able to achieve herd immunity because of anti-vaxxers. It's a quote from him: general anti-science and anti-authority and anti-vax amongst Americans will lead to issues around vaccinated to a level at which the population will be able to be safe. Is that an issue that you're concerned about here in Canada?
I think even prior to COVID-19, it's been a general issue, and of course globally. And so it's one of the top health concerns that the World Health Organization has identified. So I think it is very important for us to ensure that misinformation or disinformation is addressed right away. And actually provide information to Canadians about how COVID-19 vaccines are developed. They have to go through safety and effectiveness testing and clinical trials. Accelerating those trials does not mean skimming on any safety or effectiveness assessments. And so I think that's a very critical aspect for people to understand. But I do think we probably do need to spend more time explaining to Canadians how that process actually works and provide them with the information that they need. And I think there's, the concept of vaccine hesitancy also applies to any other childhood vaccine as well. I think some children or adults may have missed some doses of their vaccines during COVID-19, given some of the public health measures and physical distancing, and that it's time to catch up with immunization because, we could well have a measles introduction or something else. And so to sort of get yourself knowledgeable, these vaccines are safe and effective. Nothing is 100% safe. There are rare side effects for any vaccine or treatment. So these need to be explained and discussed with, between the health provider and the vaccinees. But I think the, antidote to misinformation is providing, credible sources of information, which we will strive to do. But it is something that we need to plan for right now. I think ahead of any vaccine. We're not saying for sure a vaccine would be available, but that when it does, we would have prepared or pre-stockpiled approaches and preventive measures even against misinformation and disinformation. One thing that we feel is important is for everyone to actually understand where the information comes from, to ask questions about those, to get digitally educated, as well as understanding that there are information that's simply not correct and that there are bots and all sorts of things at play. So really learn how to be media and digitally literate, I think, as well as being science and vaccine literate.
It's Dr. Njoo. Maybe I just would add to that what Dr. Tam was saying. I think certainly the experience we had this past winter, where I think at the end of the day, I think Canadians did a great job in terms of, quote, flattening the curve and not overloading our healthcare system. And so coming into the fall, when we know we're going to go into what we call respiratory infection season, flus, and so on, I think many Canadians, hopefully, are better, aware and understanding and educated the importance of vaccination. So besides the COVID-19 vaccine, I certainly would encourage people to think very strongly about getting the flu vaccine this coming fall so that you don't have a chance of overloading the healthcare system with both, people sick with the flu and possibly also with COVID-19.
Thank you, doctors. We'll go to the line for two more questions. Operator?
Thank you. Merci. Our next question, notre prochaine question is from Rob Gillies with AP. Please go ahead. À vous la parole.
Hi. Thanks for doing this. You mentioned the Blue Jays earlier, and you've provided an exemption for them to play training camp here in Canada, in Toronto, under a modified isolation measure. But a regular season requires a lot of back and forth travel between the United States and Canada, and visiting teams that don't have modified isolation practices in the U.S. coming to Toronto. So is a regular season exemption unlikely for Canada to give? I mean, you haven't given it yet, and the Blue Jays want an answer soon.
It's Dr. Njoo. Maybe I can start, and then Dr. Tam can add as well. As we said, certainly we look very carefully at the plan that was submitted by the Blue Jays and Major League Baseball, and certainly with respect to spring training, because it is just the Blue Jays and obviously with their trainers and key personnel coming in under very strict conditions, sort of as Dr. Tam and I were mentioning, sort of a modified work bubble, quarantine, certainly limiting exposure to others. And obviously in that way, there was, I think, comfort at both the local public health level as well as the provincial level and with ourselves at the federal level that there's really, I think, a minimal risk in terms of potential transmission to, quote, the general public. Because of course, maintaining the health and safety of Canadians, this is the top priority from a public health perspective. With respect to the regular season, as you've pointed out correctly, that's, as I said before, a totally different ballgame. And certainly we'd have to look very carefully at what proposal would be put forward by Major League Baseball and also the Blue Jays specifically if they were to entertain the idea, as they say, of home games and what that would mean for, quote, teams coming in. And even not for the teams, but obviously for the personnel of players, what types of precaution or preventive measures would be put in place for those players in, quote, in their home cities, especially, and as we mentioned, a lot of states that have at the present time quite high level of activity of COVID-19. Obviously, teams in California, Florida, Texas, etc. So, I think not to jump ahead, I think it's a matter of really looking very carefully at the plan that would be proposed with respect to the regular season, and then taking it from there.
There's just too much risk with the regular season plan. I mean, you're talking about multiple players, multiple staff going back from the U.S. and Canada, 3-game series here, 3-game series there. And in those cities, those American cities, they don't have isolation policies like the Blue Jays have at the hotel attached to the Rogers Centre. So is it unlikely that when you're asking Canadians to quarantine for 14 days when they come into Canada, is it unlikely that you're going to provide an exemption for the regular season?
Like I say, it's early, too early for certainly myself. I would just say to start off with this, I'm a big Blue Jays fan. I love baseball, and I'm certainly looking forward, hopefully, if they can do it in a safe manner for not just the Blue Jays, for Major League Baseball to have their, I think they call it now, their shortened season. I think they're looking at 60 games or so. I was actually around in Toronto when they won their 2 World Series, so I'm dating myself. And I still remember the crazy parades up and down Yonge Street in the whole of Toronto. So looking forward to hopefully the Blue Jays going all the way to winning the World Series. But you're right. Our priority is really safeguarding the health and safety of all Canadians. Certainly from what you pointed out, there are lots of aspects we have to look for, not in terms of just the Blue Jays, but certainly what the risk would be in terms of themselves traveling back and forth if they really were to entertain having, quote, home games at the Rogers Centre in Toronto, as well as for visiting teams crossing our border. When you look at Major League Baseball as a whole, the only thing I'll point out is that the Blue Jays are the only non-American team, the only Canadian team in Major League Baseball. And I think that needs to be part of the thinking for all of Major League Baseball in terms of how they might actually want to move forward in terms of the plans for the regular season.
Thank you, doctors. The next question on the line.
Thank you. Merci. Our next question, notre prochaine question is from Sarah Rochford with Flair Magazine. Please go ahead. À vous la parole.
Hi there. Thanks so much. This is Dr. Tam, and what I'm wondering is there any way for single people hoping to have sex this summer to do so safely?
Okay. Never got that question before. I think, again, like anything to do with social interactions in the sort of COVID era, I think do everything to reduce your risk is the key. So knowing that this virus can be quite invisible, someone could be carrying it if they are asymptomatic. I think maybe there should be a checklist somewhere. Obviously, assess your own risk. What do you have underlying medical conditions? Don't forget the risk to people that you're connected to, perhaps in your family, your parents or your grandparents who might be at higher risk. Don't date if you're sick. I think that would be important to protect everyone. And I'm not a dating expert, but let's just say, just to be sensible, maybe start virtually. And if this is a serious social contract you have with someone, where you meet them for the first time could be in a safer place, such as being outdoors, picnic in the park, I guess, separated by others. So meeting each other safely, practicing all the different hygienic measures. Small numbers of people, I mean, sort of dating large numbers and et cetera is not a wise thing. So, singular dating or smaller numbers is probably the wisest thing to do. And, so, once there is people know each other more about not just your connections, but the other person's connections that could put you or your family at risk, then, of course, everyone knows COVID-19 is spread by respiratory droplets. So if you were, kissing someone, of course, this is a potential route of transmission through which you're now in a social contract, in a social bubble, for which that is, to me, I think, something to be taken seriously. And, and people practicing, I guess, relationships in as safe a way as possible. So I don't know what to say except carefully, slowly, like all other advice on reopening social and economic activities.
Thank you, Dr. Tam. And follow-up, Sarah?
Thank you so much. Sure. So if there were to be a checklist, would that include things like maybe trying to reduce your contact slightly with other people before you intend to go about having sex with that person, or would that not matter?
Again, given individual circumstances, you might want to take as safe a possible route as possible if that is something that two individuals want to do. Of course, all of those layers of protection can reduce risk. And so that is potential. It's a bit like a modified, cocooning yourself prior to any other intimate activity is one way of increasing safety and harm as well. And of course, don't forget all the other protective measures, condoms, everything else. Do not get too enthusiastic about thinking about COVID only. There are other very safety measures that people should take if they are dating someone.
Thank you, doctors.
Thank you so much.
Thank you, doctors. That concludes today's press conference.